First of all, I'd like to thank our chairperson and the audience to sit till 10 p.m. To hear this topic. So, few points about the intervention cardiology breakthrough. First breakthrough came in 1977 when Andreas Grinzig performs the first PTCA, balloon angioplasty. After that, in 1988, it was the bare metal stent, and in 2002-2003, it was the drug-eluting stent. All the problems with stent is that the restenosis. The restenosis is an important challenge which happens after stenting. So almost 10 to 15% of the patient in long run develop restenosis of the stent. So that's why the fourth revolution in intervention cardiology, the drug-coated balloons came in the picture. The concept of these drug-coated balloons is that leaving nothing behind. So we don't want to put any metal inside the body. So it facilitates fast and homogeneous transfer of the anti-proliferative drugs into the vessel wall during the single inflation using a lipophilic matrix, and it avoids multiple layer of metallic stent. So the absence of foreign material can reduce the risk of very late stent failure, facilitate implantation of surgical graft if needed for long-term dual antiplatelet therapy. So many companies, they have different drug-coated balloons, like Medtronic, they have Impact Admiral and like Prevail drug-coated balloon. So these are the balloons which have drug covering over the balloon. So a single inflation can release the drug on the vessel wall, and that drug will remain for long time. So mostly paclitaxel is the drug of choice for the latest balloons. So if you see the latest guidelines or indications of the drug-coated balloons, like most important are the four things. One is instant restenosis, small vessel disease, then long diffuse lesion and side branch. So sometimes we have to do a PTCA of the branch vessels. So very difficult to put a stent in both the vessels. So we can put a stent in one vessel and we can dilate the side branch with drug-coated balloons. So these four are the most important indications of the current drug-coated balloons. So I'll show you one case which I have done here. A 60-year-old male, he had an anterior MI. He underwent PCI somewhere else a year before. Again he developed NSTEMI, and he was an ex-smoker, not a known diabetic or hypertensive. His lipid profile level was relatively under control, although he developed the MI. So this was the angiogram. You can see the LAD stent is patent, but you can see the middle branch, that is the ramus intermedius, has a very severe disease, almost very critical stenosis in the ramus branch. So what we have done, we put a drug-coated balloon there and inflate it for 30 seconds. So this was the result after balloon dilatation. So there was no dissection and the flow improved compared to the baseline flow. Another is peripheral drug-coated balloon. A 74-year-old lady, diabetic for 8 years, admitted for bilateral toe gangrene. So this was the angiogram. You can see the aorta, the left-sided common iliac artery having a tight stenosis, and the right common femoral, means leg vessel, is diffusely diseased, and the superficial femoral artery was occluded. So we put stent in the occluded segment, but just above the occluded segment we put a drug-coated balloon, because there was a branching at the groin, and sometimes we cannot extend the stent into the groin because we have to use the groin for the flexing purpose. So there may be chance of breakage of the stent. So we did just balloon dilatation there, drug-coated balloon. So this was the final result. Then we put another stent in the iliacs. So to summarize, that drug-coated balloons are now available, and we can use judiciously in many places where we do not want to put extra stent, and it is one of the wonder. So we have started with balloon dilatation only, then we are again coming back to the same place. So now I think that is my end of session. Thank you, sir, for your comment. I think we are at the end of session. So I just want to thank each and every one of you, the audience, the chairperson, the speakers, the company persons, everyone. So thank you very much for making this conference successful.